We're going to pick up where we left off with more of the scientific information, and we're fortunate to have Dr. Rustam Karanja, who's a neuro-ophthalmologist at the University of Ottawa Eye Institute. He completed his medical training and PhD in Canada. He completed a fellowship in neuro-ophthalmology at UCLA, where he worked with Dr. Alfredo Sadoun, whom many of you have met. He's actively involved in clinical trials and is a board member for the International Foundation on Optic Nerve Disease and LHON Canada. Dr. Karanja obtained both his doctorates in philosophy and medicine from Queen's University and completed his residency in ophthalmology at the University of Ottawa. He's currently an assistant professor and vice chair of research at the University of Ottawa and holds the Junior Clinical Research Chair Fellowship for Ophthalmology. What's really important, though, is he is one of the very few experts on LHON. He cares tremendously about this disease. He cares about all of us as patients. He just works tirelessly for all of us. He's on the board of the LHON Canada group and was instrumental in the conferences they've been having up there. He comes to these meetings and talks to us. We're super fortunate to have him on our team. Please welcome Dr. Rustam Karanja.
Thank you, Lissa. So while Lissa has been very kind in the words that she's spoken about me, I would have to say that you have a force of nature sitting up here. And it is great that last night, some of you may not know, but Lissa actually received the Stanley Davis Leadership Award from the UMDF. So certainly a well-deserved award. And as you know, I said she's a force of nature, and if you really want to know what she's been able to do, have a look at this map. This map highlights over 1,500 patients with labors that she's been able to connect over the last number of years in over 50 countries. And that is phenomenal. A couple of days ago, gave a presentation at the scientific meeting where we talked about the data that had come out of that. And everybody was in awe when the number 1,500 came up. Getting 1,500 people who have a rare disease is unheard of. And so this sort of information is extremely important because it teaches us what's going on. We learn so much from you that always improves the science, it improves therapies, it improves the medicine. And we can't do that without people like Lissa. And And to give you a sense of what some of that data showed was we have always talked about this disease being affecting young adult males. And if you look at some of the textbooks, if you go back 10, 15 years, it was deemed to be a disease exclusively of young adult males. And if you look around the room here, it's not young adult males. So understanding that and learning from that is something that we've had to change, and it's something that we're trying to get out there, and it's slowly increasing in knowledge, and it's slowly getting more appreciated. So if you have a look at the graphs here, we have a graph, right over here, which is the classical curve for male patients. You see a peak in the second and third decade of life, and then it slowly tapers off. But what's remarkable is if you have a look over here, this is female patients. And you have a line that basically is almost flat, goes up a little bit at around 15, and then comes down again a little bit about 55. But the numbers continue all the way up into the 80s. So it doesn't matter what age this disease has an effect. But when you combine these two curves, you still see that overwhelmingly you have an influence in the second and third decade, and that is largely due to the males. The other remarkable thing is that with 1,500 patients, you can start doing stats that show that 25% of the patients are female. If you only have 100 or 200 patients, it's more likely that you're going to miss a lot more female patients. And some of this can turn into a self-fulfilling prophecy. If the textbook says that this is a disease of young adult males, most people are not going to even consider it for a female patient. And as a result, they're going to get misdiagnosed, or they're not going to get the diagnosis that they need. And so you end up in a situation where the numbers may not truly be the numbers that we expect. And as we learn more and more, we find more and more things like this.